Hello, welcome to my channel, and today we will discuss liver cirrhosis. Cirrhosis is a chronic liver disease where healthy liver cells are progressively replaced by fibrotic scar tissue, causing the liver to become hard and stiff. End-stage liver disease, cirrhosis represents the final stage of chronic liver damage, at which point the destruction is irreversible. The main key functions of liver include: produces bile, the liver makes bile which is released into the small intestine. Makes albumin, albumin is the main protein in blood that maintains oncotic pressure, keeping fluid inside blood vessels. Regulates clotting and glucose, the liver produces clotting factors to prevent excessive bleeding and regulates blood sugar by storing and releasing glucose. Detoxifies the body, the liver filters and neutralizes harmful substances including alcohol, drugs, and metabolic waste products. Converts ammonia to urea, ammonia, a toxic byproduct of protein metabolism, is converted to urea in the liver and safely excreted through urine. Metabolizes nutrients and drugs, the liver processes absorbed nutrients from food and breaks down medications into their active or inactive forms. Hepatic portal vein, the blood vessel that carries nutrient-rich blood from the GI tract, spleen, gallbladder, and pancreas directly to the liver for processing. Causes and risk factors: chronic alcohol abuse. Long-term excessive alcohol consumption directly damages hepatocytes, leading progressively from fatty liver to hepatitis to cirrhosis. Chronic hepatitis B, C and D, viral infections that cause persistent liver inflammation over decades, gradually destroying liver tissue and replacing it with scar tissue. Non-alcoholic fatty liver disease, NAFLD, fat accumulation in liver cells unrelated to alcohol, driven by the metabolic syndrome triad of obesity, type 2 diabetes, and high cholesterol. Cystic fibrosis, the thick mucus produced in cystic fibrosis blocks bile ducts, causing bile to back up and inflame the liver over time. Biliary cirrhosis, damage specifically to the bile ducts, primary biliary cholangitis or primary sclerosing cholangitis, causes bile to accumulate and progressively injure the liver. Toxins and hepatotoxic drugs, certain medications, e.g. methotrexate, amiodarone, herbal supplements, and industrial chemicals cause direct toxic injury to liver cells. Diagnostics: up pointing arrow ast and alt. These enzymes are released into the bloodstream when liver cells are damaged or dying, signaling active hepatocyte injury. Up pointing arrow bilirubin. When the liver cannot conjugate and excrete bilirubin properly, it builds up in the blood causing jaundice. Up pointing arrow ammonia. As the liver loses its ability to convert ammonia to urea, ammonia accumulates in the blood and becomes toxic to the brain. Up pointing arrow PT, PTT, INR. The liver produces clotting factors, so when it fails these times are prolonged, indicating a high bleeding risk. Down pointing arrow albumin. Reduced liver synthetic function means less albumin is produced, leading to fluid leaking out of vessels into tissues. Down pointing arrow calcium. Calcium binds to albumin in the blood, so when albumin falls, total calcium levels fall alongside it. Down pointing arrow platelets. An enlarged spleen, hypersplenism, traps and destroys platelets, reducing circulating platelet count. Liver biopsy, gold standard. A tissue sample is taken directly from the liver to examine the extent and pattern of fibrosis, confirming the diagnosis and staging the disease. CT scan, MRI, cross-sectional imaging that evaluates the liver structure, detects fatty infiltration, identifies complications like varices, and assesses the extent of damage. Abdominal ultrasound, a first-line non-invasive imaging tool that detects ascites, checks liver size and texture, assesses portal vein blood flow, and screens for liver masses symptoms. Early signs: liver still compensating, fatigue. Reduced liver function impairs energy metabolism and toxin clearance, causing persistent tiredness. Hepatomegaly. The liver enlarges early in the disease as it becomes inflamed and swollen before shrinking in late-stage cirrhosis. Nausea and vomiting. Impaired digestion and bile flow cause gastrointestinal upset and loss of appetite. Abdominal pain. Inflammation and enlargement of the liver causes discomfort in the right upper quadrant. Decreased appetite. Late signs: liver decompensating, jaundice, ascites, edema, pruritus, clay-colored stools, anemia, bleeding and easy bruising, portal hypertension, splenomegaly and caput medusae. Complications: hepatic encephalopathy, severe altered mental status, AMS, asterixis, West Haven grading, high hemorrhage risk, no NGT tube and no straining. Treatment: medications, lactulose, albumin infusion and diuretics. Procedures: paracentesis, liver transplant. Diet: no alcohol, increased protein, reduced sodium, limited fluid intake and small frequent meals. Bleeding precautions: soft toothbrush, electric razor, monitor for bloody stools and avoid NSAIDs.